Dr. Sapuri today welcomed the national government's decision to recruit Cuban doctors who will help fix some chronic problems in the healthcare system. Primary healthcare is fundamental because currently doctor-to-patient ratio in a rural area is 80 to 90,000. That doesn't look promising for the delivery of adequate health services. This is because most national doctors do not want to work in rural areas.
But they will be the primary doctors that do the screening, identify where the problem is, that they can treat, they can solve, fine. I think that's the gap that is missing in Papua New Guinea. If you have that scale of people working in that level, then there is a proper referral traffic system where you can be able to move patients along in the system. Then you cut down on the complications that happen with patient care in the remote rural PNG.
For many years, Papua New Guinea's healthcare system has been struggling with compounding issues like the medical school not graduating enough doctors and lack of major infrastructure to train many more doctors.
So it's a big challenge, but of course we have to put this to the government and say it's not about just establishing the concrete and the buildings and the research and other things, but continually funding it at the level that is appropriate to make sure we deliver the outcomes the government requires.
While many may question the obvious language barrier, Dr. Sapuri said that under the Cuba-PNG Health Diplomacy, Cuban doctors will be thoroughly screened before they are selected.
The recruitment process will be established by the National Department of Health and monitored by the National Health Board and monitored by the appropriate health authorities such as the PNG Medical Board. So while there is a few people that disagree with the idea, the long-term plan would be to have a stringent process that we have in place so that we recruit the right people for the remote rural Papua New Guinea.
Meanwhile, national doctors who are jobless must immediately contact the health department or apply directly to provincial health authorities. Fabian Hakelitz, National EMTV News.